Today, let's talk about inflammatory arthritis and a quiet but massive revolution that's happening in rehabilitation. For millions of people, arthritis is a daily battle. And honestly, the old ways of providing care are really starting to show their age. So, what's next? Well, let's dive in and find out.
To really get why this is so important, we have to start with a pretty staggering number. In Europe, musculoskeletal diseases, and that includes arthritis, are responsible for half, that's 50%, of all years people live with disabilities. This isn't just about achy joints. We're talking about a huge, continent-wide impact on people's quality of life.
And that really brings us to the central question we're tackling here. We have some incredible medical treatments out there, but for so many people, they just aren't the whole story. So when the medication doesn't fully restore your ability to live your life, to work, to function, where do you turn? The answer is in rehabilitation. But it's not the rehab you might be thinking of.
All right, let's start by unpacking the hidden side of arthritis. It goes so much deeper than the inflammation a doctor can see on a scan. For a lot of people, even when the medication gets the disease under control, the day-to-day challenges stick around. And this is exactly where the traditional way of doing things is really struggling.
This right here is why the old system is starting to crack. For decades, the so-called gold standard was multidisciplinary team care. Sounds great on paper, right? But here's the catch. The research shows surprisingly weak evidence that it's super effective. On top of that, it's incredibly expensive, it needs specialized staff that are in really short supply, and frankly, it's just not sustainable in the long run.
So, if the old model is broken, what's the fix? Well, the very first step is to realize that rehabilitation is an incredibly complex puzzle. There are just so many moving pieces, which means you simply cannot have a cookie-cutter solution that you apply to every single person.
You know, in the research world, they have a name for this, a complex intervention. It's not like taking a single pill. It's a whole mix of different strategies that target different behaviors. And the most important part is that it has to be flexible. It's a living, breathing process, not some static prescription.
And this really shows you exactly why that flexibility is so critical. I mean, just think about all the variables. One person might have rheumatoid arthritis in their hands, while another has a type that affects their spine. Now, layer on top of that any other health issues they have, their own personal motivation, their family situation, and even where they live. You can see pretty quickly how a one-size-fits-all approach is basically doomed from the start.
So, all this complexity is actually what's pushing us toward new models of care. Let's take a look at what the future of rehabilitation is shaping up to be, because researchers and doctors are coming up with some really innovative ideas that are smarter, more efficient, and way more personal.
First up, we've got a concept called the shared care model. And listen, this isn't just some small tweak. This completely rethinks the entire relationship between a patient and their healthcare team. It's really all about empowering the patient and using a specialist's time much more wisely.
Just look at this comparison. In the traditional model, you have routine checkups with a specialist every few months, like clockwork. But in the shared care model, the patient decides when they need a follow-up. Your family doctor handles the routine stuff, and you only go see the specialist when a real issue comes up. This frees up those specialists and, most importantly, puts you in the driver's seat.
Next, we've got a model that's probably become a lot more familiar to all of us lately: remote care, or telehealth. This is all about using technology to bring rehabilitation out of the clinic and right into your living room. And it is a total game changer for accessibility.
And the benefits here are just huge. You're getting care from the comfort of your own home. Wearable devices can track your progress in real time. For anyone who lives far away from a specialist, this is an absolute lifeline. And of course, it saves a ton of time and money. It's about getting the right care to you, where and when you need it.
Now, these models are great for helping with daily life, but what about one of the biggest disruptions of all? Your job. And this is a really tough statistic to see. Roughly 1 in every 3 people with inflammatory arthritis leaves their job within just 3 years of being diagnosed. That number alone tells you we desperately need better support in this area.
And that is exactly where specialized work rehabilitation comes in. This is not just generic physical therapy. No, this is a targeted program that's designed to help you manage your condition within the context of your specific job. It gives you real-world strategies to help you stay productive and, most importantly, employed.
Okay, so these new models all sound fantastic, right? But, and there's always a but, there's a pretty big gap between having a great idea and making it a reality for everyone. We've got to talk about some of the major hurdles in the way.
First off, there's the research challenge.
See, the gold standard for proving a medical treatment works is something called a randomized controlled trial. But how in the world do you run a study like that when the entire point of the treatment is that it's unique and flexible for every single person? It's a genuine puzzle for scientists.
And then you've got to follow the money. Our healthcare funding systems are usually built to pay for specific one-off things, like a procedure or an appointment. They're not really designed to reimburse the kind of long-term, ongoing support that actually improves someone's quality of life. The incentives are all misaligned.
Which leads us to the biggest hurdle of all: policy. Our entire healthcare system, at its very core, is structured to handle emergencies, things like heart attacks, infections, broken bones. It is just not built to manage the slow, grinding, long-term reality of chronic diseases like arthritis.
And you can see that clash perfectly right here. On one side, you've got acute care. It's focused on the immediate risk of death, using a pretty straightforward biomedical approach. But on the other side, you've got chronic care, which has to focus on long-term disability with a holistic view of the whole person, their biology, their psychology, their social life. They're competing for the same resources, and acute care, well, it almost always wins.
So, with all that said, what does that leave us? Look, the path forward isn't easy, but it is clear. The future of arthritis care has to be personal. So let's break down the key steps we need to take to get there. The path forward really rests on three main pillars. First, we need to get much better at spotting disability early on. Not just seeing the disease on a scan, but understanding how it's actually affecting someone's life. Second, patients have to be true partners in their own care, actively helping to set goals and make decisions. And third, we have to fully embrace technology, from telehealth to AI, to create smarter, more accessible systems for everyone. And that really leaves us with this one final, crucial question. It's the ultimate challenge. We are excellent at keeping people alive, but are we ready to invest in what makes that life worth living? Is our system truly ready to value a person's quality of life just as much as it values their survival? Because how we answer that, well, that's the shift that will define the future of care for millions.